This is KXLY 4 HD News at 6:30.
Vanishing vaccinations. So who is not getting protected? According to our state's health department, Washington has the highest rate of school children not receiving vaccinations.
In fact, 6% are not immune to diseases like measles, mumps, and pertussis. The national average is just 2%.
And listen to this. Already this year, there have been more cases of pertussis, or what most people know as whooping cough, than the entire year of 2011.
It's being called an epidemic and has prompted Washington's governor to declare an emergency. So who's to blame for the rise of diseases all but wiped out in the 21st century vaccine boom?
KXLY 4's Colleen O'Brien is with us tonight. Some are blaming this crisis on parents who are simply not vaccinating their children, Colleen.
It's a tough group to be in, those who turn their backs on modern medicine. But as I've learned from both sides, it's never an easy decision, especially when you find out some doctors' offices are screening parents, asking if they're going to vaccinate their children before being seen at the clinic. It certainly is a contentious battle, with both sides claiming they've armed themselves with enough information to make the right choice.
No parent wants to see their child suffer, to choke for air. Some turn blue from lack of oxygen. Pertussis can even kill.
You see them cough and to the point of vomiting, and at night it was a lot of nights of cleanup and a lot of, drinking a lot of water and getting plenty of rest.
At 3 and 5, Julia Miller's children both contracted pertussis, more commonly known as whooping cough.
They did real well with it. They went through all the stages. It was, at times, as a parent, you just think, oh man, am I doing the right thing?
It was only brief uncertainty because Miller believes she did the right thing by not vaccinating her son and daughter.
I know that I have had a couple friends say, what are you thinking? But, at the same time, I try and let them know, well, this was our reason based on these things, and I outline them.
Squeeze your right elbow in toward your side.
Miller's decision is rooted in her medical background. As a chiropractor, she sees our bodies as being created capable of fighting these diseases naturally. It's a tough concept for most to grasp, especially when this seems anything but natural. And this is where the battle begins.
Is pertussis making a comeback?
Yeah, definitely. We're seeing thousands of cases in Washington state.
At Spokane Regional Health District, there is no question vaccines are safe and necessary. Christy Siahaya is the immunization outreach coordinator. She comes armed with a stack of research. She's here to tell you why everyone who can vaccinate should.
The hardest part of my job is talking to parents one-on-one, because they have stories, and they truly believe what they see, and they're really scared. And I have to say, as a new mom, I was scared too. It's a scary process to go through.
Siahaya says diseases we thought were gone are making a comeback.
Pertussis is huge this year, and measles is seeing a huge rise across the country.
For two reasons. One, kids that aren't vaccinated expose everyone to the disease, and waning immunity. It turns out if you were vaccinated as a child, you're not necessarily immune as an adult. And because adults don't have the classic whooping symptoms, they can unknowingly pass pertussis to an infant still too young to receive vaccinations.
We had 2 children die of pertussis last year. 2 little kiddos.
Because they weren't vaccinated.
Because they couldn't. They were too young.
A frightening reality. Washington state has seen more cases of pertussis already this year than in the entire year of 2011. This is the epidemic threshold, between 75 and 125 cases. Through March, more than 1,000 cases have been reported across the state. It's staggering statistics like this that have some doctors closing their doors.
Yeah, there are some that just won't have them in their practice.
Why is that?
I think it's the time that it takes to explain why you need to vaccinate, and probably the risk to the other kids too.
Is it sort of a discriminatory thing, do you think?
Well, I think it's our option, because we're not a public health clinic.
Christy Rice isn't one of those pediatricians. She accepts all kids at her practice, vaccinated or not. But she does her best to educate parents, and more often than not, she can convince them that vaccination is the right path.
Yeah, parents are way more hesitant than they used to be, And even in the last probably 4 or 5 years, we spend more time discussing why we vaccinate, what the diseases are, and trying to kind of allay some of their fears too.
She says parents are concerned about the safety of vaccines. Can they cause seizures? The answer is no. An ingredient that used to be in vaccines did, but that ingredient is no longer used. Do vaccines cause autism?
We've spent a lot of time proving that it's not real.
Do you wish that just every parent would vaccinate?
I would. It would it'd make our jobs easier, and it would ensure that the entire population would be healthier too.
It's an unlikely request, with a growing number of parents arming themselves with information outside of their healthcare provider, like Julia Miller, whose kids contracted and survived pertussis.
It's one of the most dangerous vaccines out there that I've been told and researched has been pertussis, and that was one of the biggest things we were against.
Her unvaccinated kids mingle with others at school every day. To do this, they must have a waiver. Last year, the state mandated that every parent who doesn't vaccinate must first be educated by a healthcare provider, then sign a waiver that says they understand the risks and benefits of immunization.
When the kids ask, I just let them know, basically, your immune system is designed a certain way, and with the way the immune system battles these diseases, it's best if your body can do it without injecting something into your system that might compromise that.
We have decades of research that shows immunization has wiped out diseases that once killed hundreds of thousands of people. Polio, measles, diphtheria. Now a growing group of parents say vaccines aren't necessary.
It has a lot to do with the fact that we aren't seeing the disease as much. So it doesn't seem like it's as scary.
Perhaps it will take decades more research to know the lasting effects of having that choice.
And my hope is that it doesn't take children dying to win the battle. That's my hope.
And hoping we're doing the right thing.
Because I think there's hope, and it's always a good feeling if you can educate somebody and have them feel confident that they know more about why we give vaccines now and feel good about giving their children vaccines.
I would hope one day that we can get to the point where we can just support our bodies naturally.
One of the main themes throughout my interviews with the Health District, Dr. Rice and Julia Miller, is education. Everyone on all sides wants you to research reasons why you should vaccinate and why you shouldn't. It's getting the facts from all sides that will help you make the right choice for your family. Of course, both sides believe they know the right choice. Mike and Nadine.
All right, thanks so much, Colleen. Great.